So I just downloaded this from our local hospital's website, and this is the birth plan that they hand out. This is available online. Different hospital systems might have varying versions of this, but this is just one example of the different things that you can choose from and express to your providers at a hospital birth. And let's just walk through it. So the environment during labor, you get to decide who is at your birth and set boundaries with who's coming in, when they're coming in, and how many people are coming in at a time. I'm actually surprised to see other children being present for labor, but it depends on the hospital if that's available. Both my babies were kind of born in the COVID time, so nobody was really allowed. And also that you get to decide what kind of providers are in your room, and you can ask people to step out. You don't need a whole audience if you don't want it. It can feel like it's not up to you, that people are coming in and it's not your choice, but you can express that you only want the necessary providers or necessary staff in there, or to keep staff to a minimum if you want less intrusion, less people in your space. So this is, again, is something that's really up to you about who's in your birthing space. Pain relief preferences. You can decide if you want them to offer you pain relief medications or not. You can ask them to change their language about how they talk about pain relief or your comfort level. So mentally, someone asking you how comfortable you are has a different impact than someone asking you how much pain you're in. And that can orient your brain to, oh, yeah, I'm this comfortable, versus focusing on the discomfort. Again, you can decide if you want to let them know if you want any pain relief intervention. So instead of saying, will you please ask me, I'm going to let you know if I want either of those things, and otherwise please do not bring it up to me. And they give different options here, like offer this as soon as possible. If my pain appears to be unbearable, please offer it to me. Or I'm going to let you know, please do not offer it to me. Relaxation and comfort measures. I love having a doula for these reasons, because nurses are helpful to an extent, and I had some really amazing nurses at my birth, but practicing and knowing what relaxation measures you want to use in advance can be really, really useful, so that in the moment your team at the hospital knows what resources to provide to you. If you want a peanut ball or a big birthing ball, if you want them to get a big tub set up for you, or a shower, so they can have all the supplies, your towels, warm blankets, anything you need for that. Using counter pressure or massage. This is really good to get some guidance on in advance, and also to practice so that you can let your partner know what feels good to you. You guys can kind of try out the different counter pressure positions together. And then in the moment, you know how to apply them once you're at your birth. If you've taken a hypnobirthing class or another birth preparation class using mindfulness techniques or self-hypnosis, cold packs. This could also be like warm or cool compresses with the washcloths they have at the hospital. And then if you want to bring essential oils, or you have a doula or a midwife that can provide those for you, something else that you could think about. These are really just thinking in advance about what helps you feel the most safe, the most relaxed, and that's going to bring you the most comfort in your birth. And chances are it's possible that these things are going to change in the moment. What felt good to practice during your pregnancy might not feel good in your labor, but at least you know what's available to you. So you can, again, ask to have a birth ball or a peanut ball. Those can be useful. The birth ball you can sit on the floor. You can lean on it. You can kneel and lean on it. Squat bars attached to hospital beds. using a chair at the bedside. Some hospitals have birthing stools that you can use. So ask what's available and have them bring those tools in so you can try out whatever you want to try out. There's no limit to what resources you can have in the room, and then you can decide what you're actually gonna use. This has to do with your hydration and taking care of your body. So basically the choices that they're giving you here are between oral fluids or IV fluids, and that's another thing that you get to consent to when you're delivering in the hospital, is whether you want an IV or a saline lock or a HEP lock placed. And it's something you should discuss with your provider, that if it's safe for you to labor without those things, you can decline them. And some people don't realize that they can say no to having an IV placed. If you have strep B, if you're positive for strep B, it's more likely that they're going to suggest that you have an IV placed for antibiotics during your labor. But again, that's something that you should discuss with your provider and something that you consent to. There's lots of different monitoring options, so knowing in advance what you want to ask for. A lot of times they're going to take an initial reading that lasts about 20 minutes where you're in the bed, but you don't have to be on continuous monitoring based on how your labor is progressing and what interventions that you have. So you can choose intermittent monitoring, which is where they're checking on baby at various intervals during contractions and when you're not having a contraction. They have Bluetooth monitors at a lot of hospitals where you can get continuous monitoring, but you're not attached to any wires and you don't have the straps around your belly. Or you could do continuous traditional monitoring where you are connected to the monitoring machine and there's a contraction monitor and a fetal heart rate monitor. And knowing what you want to ask for in advance means when you show up at the hospital, you can let them know what you're aiming for instead of them telling you what is typical. This is what I was talking about before with regards to stimulating labor. So if you need to get induced or they're concerned about how your labor is progressing, if you're concerned about how your labor is progressing, there's different ways that they can help move that process along. But you get to have a say in how that is done. So most commonly, they're going to offer things like breaking your water or using Pitocin, but there are other induction methods as well, and that's something you can talk to your provider about, like Foley balloons are something that can be used if your cervix is less than 4 centimeters dilated, and there's a couple other pharmaceutical interventions to stimulate labor that you would discuss with your doctor or your midwife. But to know what those choices are in advance and to be able to, if your doctor is suggesting that you be induced, that you can ask what their induction plan is and why they're suggesting that particular induction plan based on your body. Is this based on how dilated or effaced my cervix is? Is this based on how far along I am in my pregnancy? Why is this the best choice for me right now? And what are the alternatives? Are all questions that you are allowed to ask. You can also ask and should ask whenever given any choices, whether it's about induction or stimulating labor or any of these other areas, what the risks are of what they're suggesting. So the brain decision-making model: benefits, risks, alternatives. What does your intuition say? And what if you do nothing? You also have preferences about, this kind of goes off of labor environment. I guess they're saying birth environment here, but you are allowed to take pictures and record your birth. I actually really highly recommend having pictures or recordings from your birth because it's so hard to remember every detail, and really amazing to look back at what was happening in the room, to be able to watch, to see your baby come into the world when you're in a different headspace. I found that really valuable for myself. So think about whether you want pictures taken, what kind of pictures or videos you want taken, and who's going to take those pictures. So it could be your partner, it could be your doula, you could have a birth photographer or videographer. So thinking about that in advance and making a plan for it so people know what you want. So your birth helpers, your partner, your doula know what you want and they can provide that for you, because in the moment you're not going to be thinking about taking pictures. You're going to be focused on getting your baby into the world. You also have a lot of choices on how you push. The traditional lay on your back and push your baby out is not the only way, and it's not the most effective way to bring a baby into the world. Based on your anatomy, really laying on your back does not allow your tailbone to flex and extend in the way it needs to make space for your baby. So there's lots of other options you can ask for, even if you have an epidural. You can have a semi-sitting position. You can they can make those beds into a sort of like a throne, so you can be in an upright position even if you need your body to be supported because you have an epidural. They have birth stools. You can also be on your hands and knees. You can deliver side lying. You could deliver standing, squatting. So talking about these in advance and also making sure your provider is on board with what you want in terms of your delivery can be really helpful in preparing and knowing that you're going to be supported in delivering in the way that is most comfortable to you and your baby. So there's also choices for coached pushing or feeling the urge to push, and whether you want people like your partner or nurses to support your body or your legs during pushing, or if you don't want to be touched. Hospitals, or you could bring one, should have a mirror available so you can see your baby's head descend. And you always have the option to reach down and touch your own baby's head and touch your body so you can feel what's happening as your baby's being born. After your baby is here, you can advocate for your golden hour. So delayed cord clamping is an option, and you can ask them to delay that cord clamping as long as you wish. It's something that's really helpful to talk about with your provider or your nurses in advance so that they know what you want before that moment. There seems to be a lot of energy and a lot of excitement right after baby's born. So if you've already talked to your birth support team that you want to wait for a whole minute or you want to wait for the cord to be blanched, is gonna set you up to get what you want. Now, there's possible circumstances that would prevent this from happening, and there's times we don't have control over that for whatever reason. If there's an emergency with the baby, or there's something going on that could interrupt this, but knowing what you want in advance and expressing it means you're more likely to get it, and then asking for them to explain why that isn't possible if for some reason that gets interrupted. You also have the opportunity to see your placenta. So after you deliver your placenta, you can ask for a placenta tour so they can show you where your baby was living inside your body, and to sort of appreciate this organ that supported your baby's growth and has been with you for all these months. Your golden hour, skin to skin. As long as there's nothing of concern with your baby, you can delay any kind of intervention that you want. Your baby does not have to be weighed within 5 minutes of being born, or measured, or taken to the warmer. You can do skin to skin with your baby. And there's a lot of benefits of that first hours after birth of being skin to skin with baby in terms of bonding and that oxytocin release after birth and establishing breastfeeding. So you can ask for the skin to skin postpartum experience that you want. They can do a lot of the baby interventions when you're holding your baby. So if they're asking for a temperature or wanting to put on the antibiotic eye ointment, there's no reason that those things can't be done with your baby in your arms. Again, but the alternative is that you can have those things done at the infant warmer, and you can say, yeah, please take my baby and measure and weigh and bring them back to me afterward. Personal preference. For example, there's an option on here. I want to delay skin to skin until my baby has been bathed, if that's what you prefer. And if you have a C-section, you still have options. I'll make a different video on having an empowered C-section. Postpartum, this has to do with how long you stay in the hospital, and a lot of times your insurance is going to dictate how long you stay, and also if there's anything they're monitoring with you and baby, but you can ask for your stay to be as short as possible, or stay as long as you have coverage for. Again, you get to decide who your visitors are, how often you have visitors, how many visitors you have, and the hospital will help kind of play gatekeeper for that when you let them know. And you usually have some kind of code that you have to give out. They're going to offer you different pain relief methods, and you can consent to or decline any of those, as always. Another choice you might have to make after birth is they will often offer Pitocin after delivery as a way to prevent hemorrhaging or bleeding. And that's another choice that you get to make. So those interventions can be preventative, or they can be in response to a problem. But knowing in advance that you might be asked to make that choice, you can think about, do I want to get Pitocin sort of preventatively, or do I want to wait to see if I need it? And there's some other medications that they give as well if they're concerned about hemorrhaging. If you have a history of hemorrhaging, you might be more at risk of that happening again. So thinking about how you want to mitigate bleeding afterward, if you want to wait and see, or if you want to do some preventative measures. Something you'll probably be asked about. And then feeding, if you want to breastfeed, formula feed, meet with a lactation consultant, how you want newborn procedures to be done, if you want them done in your presence, if you want them to be done in the nursery with you or your partner there. And also if you're having a boy, thinking seriously about whether you want circumcision done, and doing your research on the pros and cons of that intervention, the same as every other intervention that you're going to encounter in the hospital.